Morning. Happy Monday. It's 10 o'clock. Yeah, I can't believe it's another Monday. It's gone by really, really quickly. And here we are again, back to some kind of normality. I think that's why my weeks are going really quick. So, teaching this weekend face to face, which was good. So, if you are on watching this, hello to the guys that were in this weekend. Morning, Becky. Morning, morning. I think did I answer? I think I answered your question that you had. I think I posted some links to some things, Becky. If I can remember rightly. Oh yeah, it was to do with lumbar spine issue with a cricketer, I think. So hopefully you got those. Morning, Sarah. Good morning. Morning, Penny. Cool. We got some of the regulars in. Cool. So last session we did about the inguinal ligament and the inguinal canal and the structures that form that canal, and then the importance of that in terms of the pathology of the inguinal or inguinal hernias. And today we're going to have a look at the abdominal region. So I've called it the muscles of the lumbar region. This is probably going to be a couple of episodes. We've done some before, so we've done some of the posterior musculature when we were looking at the sacrum, because obviously there's a connection between the sacrum and the lumbar region. So some of those muscles cross over both regions and even higher. But there are some that are specific to this area. So we're going to have a look at those today. And the way that I was thinking of doing it is splitting them up into different sections. So similar to what we did with the inguinal canal, when you had a kind of roof and then a floor and then the front and back of the canal. We're going to do the same with the abdomen area as well. So we're going to have a look at the anterior musculature, or those that are predominantly anterior, because some kind of wrap around. The ones that are predominantly posterior, the floor we've already had a look at because we've done a whole session on the pelvic floor, so you can have a look at that. And then superiorly, we've got the diaphragm, and when we have a look at the diaphragm, we'll then bring in some of the blood vessels and things like that as well. So we're going to be connecting those that kind of pelvic floor area, and then going up into that thoracic cavity where the lungs are, and the heart and all that kind of stuff as well. So should be that should keep me busy for a little bit. Good morning, Michelle. Good to see you in as well. I did call. Thanks, Becky. Thank you. Tristan's in too, and Fiona. Good morning, everybody. Beth. I haven't seen you for ages, Beth. Cheeky wee listen while trying to get the kids packed for our holes. Oh, nice that you're going away on holiday. Brilliant. Enjoy. There's nothing I could think of that I would do when I'm going on holiday than listening to this. Oh, bless you. Thank you very much, Beth. If you're struggling with the kids keeping them entertained, then obviously who needs cartoons? Okay, so let's have a look at this. Okay, so anterior muscles first, and what we're gonna bring this all back to time and time again is this. So these are the layers of the musculature. And I'm going to introduce you to this now, and then hopefully by the end of this, you'll know what the layers are and what the arcuate line is. Okay, so fingers crossed, obviously, if you've got any questions as we go along, then give me a shout. So if I just grab my arrow here, I think I need my glasses on because I can't. I'm struggling to see. Okay, so we've got two pictures here of the same musculature. And if you've never looked at any of the abdominal region before, we've got four main muscles on the front of your belly. Okay. So some of this stuff we've looked at already when we did the inguinal canal and the inguinal ligament. So some of the words you might have heard before. And if you've ever done a little bit of anatomy before, you probably would have heard some of these as well. So we've got, I don't know whether you can see here, but we've got these layers here. So we've got this, and we'll start with this top layer first, and then I'll explain why we've got two layers here. So we've got something called the parietal peritoneum. And the parietal peritoneum is a covering of the abdominal contents. So you have this thin layer of fascia that basically covers connective tissue that covers all of your abdominal organs. And we're going to go into that in a bit more detail down the line, but it's important to realize now because there is a weak point, or can be a weak point, in the abdominal wall because of this structure right here. So this will kind of make abdominal hernias make sense. Okay, so we've got the parietal peritoneum that wraps around here. So if you can imagine this side, if you were lying on your back, and you were looking down your belly, and you could see through the muscles, the cross section of the muscles, this is the view that you would have. So underneath this line here, underneath this yellow line, this is where all your guts would be. Okay, then you've got this parietal peritoneum layer. Then you've got this next layer. So can you see that thin layer above the peritoneum? And that's called the transversalis fascia. And that we mentioned last week when we were looking at the inguinal canal. So the transversalis fascia forms the back wall of your inguinal canal. Okay, so imagine looking down your body. The deepest layer, looking down with your guts underneath, would be the peritoneum, and then just on top of that, you'd have this layer of fascia, this another layer of connective tissue, just before you get to the muscles. And then the first muscle you get to, which is over here, is your transverse abdominis muscle. So see that one there? So that's the lowest, the deepest muscle on your abdominal wall. So on the front of your belly, that's the deepest one that we've got. And it's not like so muscles have got tendons at either end, and we've seen that time and time again. But in a lot of muscles, the tendon is very thin, and it's more like a spiral and kind of thickness of your finger. Okay, so it's quite a thick tube basically. Whereas in the abdomen, it's very different to that. So the muscle is here, but then these bits here, this is all tendon, but it's really flat. And anything where it's flat and it's a flat tendon, they give it a different name, and it's called an aponeurosis. And you might have heard that before. So you might have heard of aponeurosis before. And when we did the inguinal canal last week, we mentioned that a few times. So a flat tendon is an aponeurosis. So where your innermost muscle is, the transverse abdominis, you've then got this flat tendon that wraps around your six-pack muscle. Can you see the six-pack muscle in the middle there? So again, looking down your belly, obviously you're ripped and you can see your abs. And if you cut through your abs and you could see the end of them from the top down, you would see this fascia wrapping around the underneath, so the deepest part of your rectus abdominis muscle, and that's this bit here. Okay, I'm going to do this now, and then we'll unpick it as we go. But I need to show you where we're going. Okay. So that's your first layer. So that layer there, it goes underneath there and then wraps underneath that rectus abdominis. Then the next layer is your internal oblique. Okay? So oblique just means like a different angle, and you've got internal and external obliques, and we'll have a look at those in a sec. This internal oblique is the middle layer of your abdominal, your anterior, your front of your abdominal wall. And that's got an aponeurosis as well, so it's a flat tendon. But the internal oblique is a bit different. Okay, so whereas the transverse abdominis is flat and it wraps underneath and then joins in the middle here, the internal oblique splits into two. So a posterior part of it goes under the rectus abdominis, and the anterior part goes over the top of it. So it wraps all. So imagine that was your rectus abdominis. The internal oblique would wrap around it like that. Okay, so transverse would go under, internal oblique would wrap around the whole thing. Yeah, and then the last layer is this one here, and this is your external oblique. So the most superficial of all the muscles. This one has only got one single layer of connective tissue as well, and that only goes over the top. Okay, so rectus abdominis in the middle, transverse abdominis fascia, so aponeurosis, goes underneath, internal oblique wraps around it and covers the whole thing, and then external oblique goes over the top. So your muscle in the middle, those six-pack muscles, the rectus abdominis, is wrapped in the tendons of these three muscles. Okay? Hopefully that makes sense. Now this is where it gets a bit confusing, because there is something called the arcuate line, and basically that just means an arced like curve, and some people have these, some people don't. They are usually in the lower portion of your abdomen, and this is one of the reasons why if you do have a herniation, then it's usually in that lower part of the abdomen, or sometimes it's around the edges as well of things. But in the lower part of the abdomen, if you have a look here, transverse abdominis, internal oblique, and external oblique don't go behind the rectus abdominis. They only go in front. So higher up in the abdomen, that one goes under, so the transverse under, internal oblique wraps around all of it, and then external over the top. But then as you move further down, it doesn't wrap underneath anymore. They all just go over the top. So that means that the only thing stopping your guts poking through is this layer of peritoneum and the transversalis fascia. Whereas up here, the thing stopping your guts poking through is peritoneum, transversalis fascia, transverse abdominis, and internal oblique. Okay, so you've got much thicker layers of fascia in the uppermost portion of your abdomen than you have in the lower part. Okay, so hopefully that kind of makes sense, and we're going to unpick all that in well, hopefully now. So let's have a look at some videos. Hopefully these videos work. I've had a bit of a mare with that one. It's gone really small for some reason. Right, let's have a look at this. This one's normal size. Okay, so here is your six-pack. So this is your rectus abdominis muscle on the front. So we're going to start with that, and then we're going to wrap the muscles around it as we go. Okay, so we'll kind of add layers on. So this is your rectus abdominis. Let me just get rid of that a second so you can see everything. There we go. Cool. So this is obviously your six-pack. I took this photo earlier, and you can see it's a bit irregular here, not of someone else, obviously me, and you can see that the muscles are a little bit irregular here. So this guy's got 1, 2, 3, 4, 5 on that side, and then it looks like 1, 2, 3, 4 on that side. So you can have these like interdigitations, these bits of fascia in between the muscles, so you can have more muscles on one side and fewer on the other. Okay, and that's quite common. And so this guy's obviously perfectly symmetrical, but you may see some people where it looks a bit wonky, and that's entirely normal to have that kind of presentation. So there's your rectus abdominis, so your six-pack muscle, and that bit there, that underneath, that's your transverse abdominis, and we'll go into that in a second, but that's your transverse abdominis underneath there. Okay, so let's add on these bits. So you can see that wrapping underneath. So the rectus abdominis narrow at the bottom, wide at the top, so it attaches You just pause that there, to your ribs, your top ribs, and your something called your xiphoid process. So if you have a feel of your ribs and then come all the way into the middle of the ribs, you will feel probably quite a tender point as the ribs meet. And some people have it, some people don't. But there's like a little dangly bit of bone in on the bottom of your sternum, and that's called the xiphoid process. Okay. Um, yeah, was working at the CrossFit comp on Saturday with Matt. Seen all the abs I can take. Yeah, you're showing him how it's done, mate. Absolutely. Yeah, so you'll definitely see lots of abs at a CrossFit gym. So we've got attachments on the ribs 5 to 7, the costal cartilage. So that's where it's not really bone. It's where the ribs merge into cartilage and then go into the sternum. But we'll talk about that when we get to the thorax. And then this point here, the xiphoid process. So you've got this sticky down bit on the bottom of your sternum, and your rectus abdominis will attach into there. It goes all the way down into the pubis. Okay, so onto the pubic crest and the pubic symphysis. So all the way down here. Okay, so those are the attachments of your rectus abdominis. So you can see there the pubic attachments in that little video. And then we're going to have a look at the different layers. So we've got these sheets. A sheet of muscle is divided into these sections, and we just talked about that. So this guy's got a few more on this side. These are tendinous intersections. So these are bits of tendon in between the muscles. And rectus just means long. Okay, so rectus abdominis is long muscle in the abdomen. Rectus femoris is long muscle in the leg. Okay, or on the femur. So that's why they're called rectus. So we've got these interdigitations here, and then you'll be able to see the coverings, the first parts of that where everything merges in. So let's just have a look at this. Okay, so the rectus abdominis is enveloped in a fascial sheath. So if you peel back the rectus, then that's what's underneath, and that's the posterior rectus sheath. Yeah, so if we hopefully, I think I put it in remember that picture where it's kind of wrapping around things. So here on this bit, it's made up of the tendons of the internal oblique and the transverse abdominis. Yeah, so those were the ones that were going under. Whereas down here, so lower down in the abdomen, you don't have a posterior rectus sheath, not made up of those tendons anyway. So down here, it's made up of the peritoneum and the transversalis fascia. So it's this is the area where it's on at a weak point. Okay, I should move that out of the way. So there's the arcuate line just there, and you can see. Okay, I put a different thing in here. Yeah, so this is the fascia going underneath. This is the internal oblique where it splits. But then, so this is higher up in the abdomen here. Lower down, all of these go over the top of rectus abdominis. So they go over the top of this muscle here. So then you're left with a weaker portion here. And you can usually see it. It's usually, yeah, there you go. So it's the arcuate line. So this lower portion doesn't have as many layers of fascia. It's just covered by that peritoneum layer and the transversalis. And then we'll have there's another wrapping over the top. Here we go. So this is the anterior sheath. So the covering over the top, and it's made up of the tendons of the internal and external oblique. So that's these ones here. So there's your internal oblique and it wrapping over the top. There's your external oblique wrapping over the top. So that's what we can see here. Down in this section here, it only goes over the top. It doesn't come underneath. Okay. That line there, that is the cut edge of your external oblique. And that one there, that muscle there, that is your internal oblique. Okay, so they both merge together and go over the top of your rectus abdominis, and they join in the middle. So there's the fascia, you can see there. and this is what it looks like underneath. So they've just taken a line through, and it's really, really stuck. Okay, so you can't peel it off. But what they do is dissect it, and they show you what it looks like. So here we go. Here's the dissection. So this is the anterior sheath, and then that's what it looks like underneath. So there's rectus abdominis, and then just poking through there, that's your posterior sheath there. So you can see it's completely surrounded, that rectus abdominis, by all of these muscle tendons. And then the linea alba, we'll just hold that there. This is the line down the middle of your six pack, and it basically means the white line. And this is where all of the fascia connects. So from the transverse abdominis, internal oblique, external oblique, they all come together and join together on that white line. Okay. No worries, mate. No probs. Technical issues. Cool. So yeah, there's your anterior. There's the linea alba. So xiphoid process down to the pubis, and that's your rectus abdominis. Okay. So if we have a look back at this PowerPoint, that's basically what we've just seen. Okay. So we've seen the rectus abdominis muscles here, and then we've seen the anterior sheath, and then the posterior sheath there. So when they took the anterior sheath away and they peeled it back, you could see the posterior sheath underneath. Yeah, and then the white line in the middle, that's where they all join. So that linea alba just there. Okay, so yeah, that's the first stage. So what we're going to start to do now is add on these layers, and hopefully it will make the picture make sense. So this muscle here is your transverse abdominis. So transverse means across, so it's going across your abdomen. Okay, and you can see here there's the muscle section, and then this is the tendon section, and this is the flat tendon. Okay, and you can see here again what you might not have noticed before, but there's a divide in the tendon here and here. So here was for the inguinal canal, and then here is the arcuate line. Okay, and this flap of tendon goes over the top of rectus abdominis, whereas this flap goes underneath it. Okay, and again, you might have seen this picture a million times but never really noticed that, and that's why those are there. So let's have a look at the video of this. Just get the right video. Get that one in, get rid of that one. Here we go. Okay, so there's your rectus abdominis. We had a sneak peek at the transverse before, so that was just under there. We're going to have a look at that in a bit more detail. So there's your transverse abdominis, and you can see the muscle section here, and then the flat aponeurosis just there. Is there a reason that the lower rectus abdominis isn't enveloped in the other muscles? I'm not sure. I'm not sure. I will find out for you. Yeah. Yeah. That maybe obviously some theories behind it. Yeah, but I'm because there's nothing really that passes through that region other than the stuff we talked about last week with the inguinal canal. There are some other muscles that can be there, pyramidalis muscles, I think they're called, but sometimes they're absent. So yeah, I'll find out for you. It's a good question. Thanks, Becky. You always ask good questions. Get me researching. Okay, so there's your transverse muscle fibers there. There's the flat tendon there. So this is the aponeurosis of the transverse abdominis. So there's lots of big words today. Sorry. Let's just play that again. So you can see it going underneath rectus abdominis, and it goes all the way underneath. There we go. Just move me out of the way. So this is the picture that was on the PowerPoint. Obviously the opposite side, so it's a bit confusing. But there's your muscles. So your muscles here, attaching onto all of the ribs and the costal cartilage. So we've got all of the attachment points here. Try to include these on all the muscle pictures now, so you've got everything all in one image. So ribs 7 to 12, the costal cartilages, which are these bits up here. So it's where these are the bones of the ribs, and then this is the cartilage. The thoracolumbar fascia, which we have talked about ages ago when we looked at the sacrum. Okay, so that's around the side here. We'll have a look at that in a second. The internal iliac crest, so around this area here. Okay, so inside of the iliac crest, and then on the inguinal ligament, which is down here. Okay, so let's have a look at that. Yep, so some people have an arcuate and some people don't. Does this affect anything? Yep, it affects your likelihood of having an abdominal hernia. Yeah, so those that don't have that line, then they're less likely to have an inguinal hernia. So yeah, some people have it, some people don't. Yeah, I'm not sure of the percentages of who has it and who doesn't, but yeah, if you don't have, if you have that line, then you're much more likely to have an abdominal hernia. Yeah. Okay, so there's the attachment there. So iliac crest down onto the inguinal ligament, and then there is your costal cartilages. So along the ribs, there's your thoracolumbar fascia around the back, just there. Okay, and whilst we're looking at this, I'll just pause that there. We haven't covered it yet. We will do probably next week. But the QL muscle, and we've talked about this before, but I want you to just think about the layers that the QL is underneath. This is the first layer. Yeah, so we've got the thoracolumbar fascia around the back. Then you've got the transverse abdominis. In a minute, you're going to see internal oblique, and then you're going to see external oblique. And to think that you can palpate QL, you've got no chance. Okay? It's just so deep and really quite small. Yeah. So yeah, and again, if you've been to the labs, then you will have seen that. But it's I would say it's nigh on impossible to palpate. You'll be in the region of it when you do manual therapy, but there is just no way you'd be able to isolate that structure. No chance. So there's your iliac crest, just there, and then down into the inguinal ligament, which is what we looked at last week with the inguinal canal. So there's a bit of a gap where the structures come through from the abdomen through to the pubis. So aponeurosis is flat tendon. So this merges with the internal oblique. So the internal oblique will be on top of this, and then they merge together, and the TVA goes underneath the rectus abdominis, apart from this lower section if you have an arcuate line. Okay, so that is your transverse abdominis. That's this one. Okay, and then the next one to add on, so the next layer above is your internal oblique. And again, it's a similar kind of structure. So you've got a muscle structure here and then a long flat tendon again. And you can see how it attaches to everything here. So from your thoracolumbar aponeurosis, so thoracolumbar fascia around the back, the iliac crest and the inguinal ligament, and then attaches onto your ribs, the pectineal line, which is on the pubis and the linea alba, which is the white line in the middle. Okay, so a massive muscle again. That kind of wraps around like a corset in exactly the same fashion as the transverse abdominis. The slight difference with the internal oblique is the obliquity, so the change in direction of the muscle fibers. Okay, so transverse abdominis is literally transverse, so it comes across. The internal oblique is more like a fan. Okay, so we'll have a look at those now. Just get that one on there. Here we go. So this is your next layer. So there's your internal oblique. Let me just go back one. Okay, so that is your, oh, that's a good transition actually. So you can see the transverse abdominis underneath. So there's transverse abdominis. There's the aponeurosis of transverse going underneath rectus. And then there's the internal oblique on top. Okay, and then this line you can see here, this is the cut edge of the external oblique. So we get that outermost layer before your skin. So underneath here will be your rectus abdominis. There'll be berries underneath there, but you can see the fiber direction of these oblique muscles, and they don't just go in one direction. They're like a fan all the way around. So the kind of center point around here, and then they come up and then around and then down like that. So like well, I'll show you a little picture in a sec, like a fan all the way around there. Okay, so those there are your attachments. So you can pause this video and then have a look at these and see what they do, what nerves supply it and everything. And that's your thoracolumbar fascia at the back. So again, we've got that connection with the back. Deep to this is your transverse abdominis. So again, think about those layers getting through to QL. Yeah, so you've got to go through thoracolumbar fascia, internal oblique, and transverse abdominis so far. Okay, to be able to palpate that. There's your iliac crest, and then these are your ribs just here, and you can you'll be able to see in a sec the direction of the fibers. So it attaches all onto the iliac crest, and then down onto that inguinal ligament, which we looked at last week. And there's a little gap down here, which is where the contents from the abdomen come through into the pubis. So either the round ligament in females or the spermatic cord in males down there. And then this is the fan shape. Okay, so you can see all of these different directions of fibers, and they change direction as they move down. So just like that fan on the right of the picture just there. Okay, so again, you can see where the muscle changes. So these are the attachment points, all on the ribs, and then into this internal oblique aponeurosis. So this is the muscle that wraps around, so rectus abdominis in the middle, and then it wraps around. So TVA will go under, transverse abdominis will go under, internal oblique will wrap around in the uppermost portion of the abdomen. So if you have a look at this area here, there's the arcuate line, and then underneath that it goes over the top. Yeah, so we don't have that covering sometimes down here. So yeah, this is your internal oblique aponeurosis. So it will split and wrap around your rectus abdominis, and then the external oblique, which is that line just there, will finish the top. Okay, so wrap around the top, which is that top line just there. Okay, just play that again. So it merges with the transverse abdominis underneath, and then that forms your posterior rectus sheath, and it merges with the external oblique over the top to form the anterior. So your six-pack muscles are under there. That's your anterior sheath. So above the arcuate line, just pause that there, the internal oblique and the transverse abdominis pass behind rectus abdominis. Okay, so around that region there. Just press play again, there we go. And then where the arcuate line is, so around this region here, so it's basically halfway between your umbilicus and your pubis. So it's if you have it, then it's around that line there. And then just get rid of that on my screen. There we go. Below the arcuate line, the internal oblique and the transverse abdominis pass in front of rectus, if you have one. Okay, so that's important, because sometimes you don't. Okay, so that's the kind of order of everything. So if I just go back there, it's around those levels. If I just bring that other arrow back in, yeah, so there, so it's around this area where that line would be, and it is like a curved line. You see it on dissection. It's literally, it is an arc. Yeah, so it's an arcuate line, that arced line, and the fascia just changes. Wonder if this is where the theory for working upper and lower abs comes in with the arcuate line. Yeah, but do you know what? I was thinking exactly the same. Yeah, I was thinking that because it would, I think it would feel different around that region. Yeah, so but yeah, possibly. Right, cool. So that's your internal obliques. So far we've done transverse abdominis, innermost layer, with the aponeurosis going underneath rectus abdominis. Then the internal oblique, which there's the next layer on top of that, where the aponeurosis, the long tendon, the flat tendon, wraps around rectus above the arcuate line. And then now we're going into the last one, which is your external oblique. So this is the outermost layer of the abdominal wall. This attaches to your ribs, the ilium, anterior crest, inguinal ligament, and linea alba. So again, all of these similar structures that we've heard of before. And we looked at this as well when we looked at the inguinal ligament, because obviously the attachment is down onto the inguinal ligament. Okay, so important that we've done that first. Okay, so let's have a look at this external oblique, and this is where the video went a bit funny. It went a bit small for some reason. So hopefully you can read this. It's gone in absolutely tiny. I can't read that at all on my screen. So hopefully you can. I'll try and sort the video out for next week, and we'll do a bit of a recap. But this is the fiber direction of your external oblique. These are your ribs up here, aponeurosis at the back, iliac crest just here. Okay, so this is the right side of an abdomen looking from that side. So now what we're missing is the skin and the subcutaneous fat. So the layers are subcutaneous fat, skin, sorry, subcutaneous fat, external oblique, internal oblique, transverse abdominis, thoracolumbar fascia, then QL. Okay, so that's how deep that QL is in that bit there. Okay, so it's really deep structure, and I've mentioned it a few times, but we'll have a look at it in a bit more detail next week when we look at the other muscles. No, no, I got no chance either. Basically, what it is a copy of this. Okay, so hopefully you can read that one. That one's okay. So yeah, ooh, just press the wrong button. There we go. So yeah, that table in the video is a copy of that table there. So yeah, there's your aponeurosis. So you can see the aponeurosis there. There's the muscle. There's your thoracolumbar fascia around the back. And then this is the outermost covering. Okay, so this aponeurosis here is the outermost section. There's your ribs, iliac crest. So you can see it attaching onto the ribs. And interestingly, with this muscle, you'll see it more here. Here we go. So these muscles here, these are your serratus anterior muscles. And you can see serratus is continuous with the external oblique. So it kind of wraps around from the front, attaching onto your shoulder, and then down into that external oblique, and they follow the same fiber direction. Okay, so that's quite cool. So we've got these. You can see the little bits of tendon where they attach into the ribs here, and then it just continues with external oblique there. So here is your fascia that we've been talking about. So this is the outermost layer. So your rectus abdominis will be underneath here. Yeah, iliac crest just along there. So you can see the fiber direction, thoracolumbar fascia there. And then this is the final bit. So this is your anterior rectus sheath, this section here. So that's external oblique aponeurosis. So it's the tendon of the external oblique, and that wraps over the top, which merges with the outermost layer of your internal oblique. Yeah, so they merge together to wrap over the front of your rectus abdominis, and you can just about see the rectus abdominis poking through just there, and you can see the thickened white line, the linea alba, just there as well. Okay. Yeah, so there's your linea alba. And I think, yeah, and then your ASIS and your inguinal ligament just there. And we looked at that in a bit more detail last week. And then there's the final picture of the sheath all together. Okay, so let's go back to that very first slide. Just go back to that one. So hopefully this all makes a bit more sense now. So you've got six-pack muscles in the middle. There's your TBA, transverse abdominis, going underneath. Internal oblique wraps over and above, so surrounds both, and then external oblique over the top. Yeah, this is a good point. Yeah, really good, Ellie. So you've got thinking about all of these layers of surgery, e.g., cesarean. I presume when repairing the incision, they don't sew individual layers. So with healing, is the definition of the layers lost? Yes. So I will try and find an image for you. But basically, what will happen is all of the layers will stick together. Yeah, they'll all just be uh, um, they'll get fibrotic between the layers. Yeah. So I've seen a couple of dissections like that where yeah, there's no slide or glide with any of the layers. They're all just joined together. Yeah. So yeah, that's a really good question. Yeah. Cool. So hopefully that makes the anterior abdominal wall make a bit more sense, and we've covered the floor section already, so you've got where it goes into with the inguinal ligament. So now you've got inguinal ligament, the inguinal canal where the structures come through, and how everything is formed on that front part of the abdomen. So hopefully this will make things like diastases recti if you deal with pregnancy, or well, you don't have to be pregnant to have it, but if you have a distended abdomen, then that can cause a separation of your rectus abdominis. So it will make a little bit more sense with the layers that are affected and the structures that are affected. And also the reason why you might get abdominal hernias. So we looked at inguinal hernias. These are some of the reasons why you might get an abdominal hernia, because of that change in the fascial layers. Okay, cool. And that is it. Any more questions? No, all good. Cool. That's it for this week. So hopefully that was useful. Yeah, if you've never looked at the abdomen, never really heard of those muscles before, then that's what they're called, and that's what where they are. I'll try and follow up on some of the questions that we had. Some good questions today. And yeah, if you got any more questions, if you're watching this on catch up, then just let us know in the comments, and I'll try and answer them for you. If I don't know, then I'll try and find out. And Catherine the other day asked about finding the videos, and found a really easy way to search the whole of Learn Anatomy online. Just in the find section in the little magnifying glass, if you type in the episode, so episode 10, then it will take you straight to that episode, and you can literally work your way through all of the episodes. So if you've got some to catch up on, then literally do a search for episode 20 or whatever it is, and then it will go straight to it. Cool. No worries, guys. Good to see you. Oh, Rach is here as well. Good morning, Rach. Yeah, no problem. Thanks, Sarah. Good to see you in the morning. Thanks for coming. Is Beth still there, or has she left? It looks like she's gone on holiday. Cool. Have a good week, guys. I'll see you next week.